Hi, so this exercise that we're focusing on is going to be for two main pathologies, being greater trochanteric bursitis, which is pain on the outside of the hip over here, or IT band, also known as iliotibial band syndrome, that goes all the way down the leg. The exercise is straightforward and something you can do while sitting at home. The way in which it works is if the right side is our affected side where we have the pain, one of the things that we can do is put the left leg in front of you so your non-affected leg is straight. Your right leg, which is the affected leg in this instance, is draped over the ankle. Then what you do with your hand, not your hip, because you need to use something other than the muscles you're trying to stretch to obtain a good stretch, is push along the inside of the knee. And you'll do that for a count of 5 seconds. And then you'll relax. And you'll do that again for a set of 10. Now, this exercise is a graded exercise that increases the amount of stretch to this muscle complex. When you do this, you do not want to feel pain. You want to only feel a stretch. Pain to muscles is actually a signal that you're injuring them further, and stretch is how you will make them better. So if this, at this instance, causes pain, then you need to reduce the amount of stretch. The way in which you would reduce the amount of stretch is you can take your left leg and move it further in front of your body as such, and then put your hand to cause the stretching motion yet again. Now, in extreme cases where you have advanced trochanteric bursitis or IT band syndrome, and even this causes significant pain on the outside, you can do it where you just rest your leg on the ground and proceed to do the stretching exercises for 5 seconds for a set of 10. And you will do this twice a day. Now, once you find the area where you feel a stretch, that is where you will start at, and you will remain there for a week. If you're starting with your left leg in front of the body, in a week's time you'll move it in front of you a little bit further and complete it for another week, twice a day, 5 seconds, set of 10. Once you hit this point in time with the leg is directly in front of you and you're stretching, what you'll do after the next week is you'll move your leg up an inch. And every week, you'll subsequently move up an inch so that you're trying to feel a stretch and not pain. Until eventually, after many months, you hit this point in time and it should relieve the pain that you have on the outside of the hip. Now, after you've been doing this for approximately 6 weeks, the next level is to work on a small strengthening component to this as well. The strengthening side to this allows you to slowly build the muscle back up for part of the hip complex that is affected in this pathology. The way in which you do that is if you are standing with a table in front of you, you have both feet pointed straight, shoulder width support. With your shoulders not leaning one way or the other, but straight up and down, you will take your leg, your affected leg, and go to the outside, keeping your toes pointed straight for 5 seconds, and you'll do a set of 10. You can make this more difficult by leaning towards the affected side, and make it easier by leaning away. Once again, with this, you do not want to elicit pain. You only want to elicit a feeling of a small amount of strengthening. This is a process that takes many months to resolve and improve.